Okay, guys, we're going to actually go ahead and get started. Chandra, you can just join in whenever you get your laptop set up. I met the few that are here tonight. My name is Raul Lona. I'm a physical therapist here at M3 Physical Therapy. And tonight we'll be talking about low back pain and sciatica. And then we'll also have a few slides at the end to address some of the issues that some of you may be having with back pain or seating issues related to, you know, a poorly fitted chair, maybe a desk setup that is not right for you, and that's causing some problems for you. And that's particularly important right now because a lot of people are working from home during this COVID pandemic, and their setup maybe not, you know, the way it is in their normal office space. Okay, so I'm going to share my screen here and pull up my presentation. So just bear with me here. Okay, so you should see a presentation here. Let me just pull up my, okay, here we go. Okay, you guys see a red dot here, correct?
Right.
Good. All right, so let's get started here. Oh, just hang on one second. Okay, so we're presenting this from M3 Physical Therapy. We are a clinic in West Hills as well as in West Los Angeles. In case you guys are not familiar with our clinic or just joining us from a Facebook ad that you guys saw online. We've been in business for about 40 years, serving the orthopedic needs of the community here. And we do these workshops every month. We cover anything from balance to low back pain and sciatica, as well as shoulder and rotator cuff pain. So we have been in this community for quite a while, starting in the West LA community going back to 1981, and recently more into the Valley as of 2017. All of our therapists, or most of our therapists, are orthopedic clinical specialists. What that means is that we hold a special degree, not only as a physical therapist, as a doctor of physical therapy, but also as an orthopedic certified specialist, more of like a specialist in the orthopedic realm. I particularly have a lot of experience in orthopedics. I've been practicing now for almost 20 years with several publications specifically on lower back pain and treatment with diagnosis as well. And our clinic itself, you know, like I said, all of our therapists are, you know, orthopedically certified and have been serving the needs and serving and treating patients over the years, probably thousands of patients with low back pain and sciatica. Okay, so that's a little bit about ourselves. Let me just get rid of this here. Okay, so our topic tonight will be low back pain and sciatica. Let's talk about the sciatic nerve first. The sciatic nerve is the largest nerve in your body. It runs from your lower back here. You can see my pointer here. Comes out of just above your, what we call your glute max, and this is the sciatic notch. That sciatic nerve travels down the leg, down the side of the leg, and all the way down the back of the calf and into the toes of your foot. And it travels, as it travels down, it actually creates two nerves, your peroneal and your tibial nerve here in the calf, and it provides innervation of both sensation and strength to the lower leg of your body. Okay, so when you think about sciatica, basically sciatica is a pinching of this nerve, and the way you want to look at it is kind of like the analogy that I use is a garden hose. Okay. When you are gardening or you're watering your plants or grass, and you hear a gurgling sound in your hose and the water pressure decreases, what's the first thing you think of? There's probably a kink in the hose, right? So somewhere down the path of that hose, there is a knot or a kink in the hose that's decreasing the pressure and creating the gurgling sound down the road at where the water comes out. So you have to look back and trace back that hose. Where is that kink and how can I relieve that kink so that I can get the water flow to flow the way it should? That's exactly the way sciatica works. Somewhere along the path of that nerve down the leg, there is a kink or something pressing on that nerve. So our job as healthcare providers, as physical therapists, is to find out where that kink is. Where is that, you know, a compression on the nerve that we can address our treatment to. And the more specific we can be in terms of where that kink is, the more successful our treatment is going to be. Most times that kink is going to be in the lower back, right into this region here, but it can be in the gluteal area called piriformis syndrome. It could be along this calf area, along the peroneal nerve at the fibular head, or it could even be in the ankle. We as physical therapists are trained to diagnose where that pain or where that kink is, okay? So what the common causes of what causes that kink or that irritation on the nerve is what we're going to be talking about tonight. There's 3 common causes, which I'll talk about tonight. The first is a disc injury, and that's the most common. The second is stenosis, DJD, DDD, all fancy terms for basically arthritis of the lower back that's causing a compression on the nerve. And then the third part is a sacroiliac joint problem, where the pelvis and the joint that it makes with your sacrum in the back is irritated, and that's creating an irritation on the nerve and causing that pain down the leg. So let's first talk about a herniated disc. And this is the most common cause, like I mentioned, and this affects people usually a little bit younger, usually about 20 to 40 years old. These people tend to have pain with bending and sitting. Okay, so if you have pain with bending and sitting, and you're around that age, this is probably what's causing the kink and causing the pain on the nerve and the sciatica down the leg. When you think about a disc, which is this white substance here along my pointer, these yellow guys here are vertebra, and then you can see the nerves in between. When this disc gets irritated and inflamed or injured, it's going to look like this red disc gets irritated, and you can see there's not a lot of space through here. So the nerve runs right through here and down the leg, and when that disc gets irritated or inflamed, it's going to put pressure directly on that nerve. There's your kink, and there's going to be that pain that goes down the leg. So when you look at it and you want to talk about a disc specifically, think about it like a hard jelly donut. On the outside, it's hard, and on the inside is a gelatinous substance that is made up a lot of water. And when you injure that disc, that jelly tends to, there's pressure on the disc, and that jelly tends to migrate toward the outside of the disc. And if it's with enough force, that jelly pressure is going to burst that donut and create this bulging here, which is called the herniated disc. Okay, and sometimes that disc can be injured so badly that that jelly completely, that fluid completely leaks out of that area and puts pressure not only on the area where it's herniated, but that jelly travels down because of gravity and can put pressure on the nerve down below. Those are really difficult cases. Most of those cases will need surgery. Okay. So these people, what they're gonna report is that when the pain is with bending or sitting, but they get relief when they're standing and walking with extended type of positions. And the reason being is that when you're in a more standing extended position, you're in a less of a flex position, and that extended position puts a pressure such that it pushes that disc back into the position where it needs to go. Okay, so if that occurs, then it'll take the pressure off of that nerve, as we see here. Okay, so when we treat somebody with a disc injury, we first need to consider how acute are their symptoms. If you're coming in with a really, painful disc with a lot of inflammation, a lot of pain that doesn't even allow you to walk, then we're going to try to calm down that inflammation with ice, sometimes heat, modalities. Manual therapy. We do a lot of manual therapy in our clinic. That is one of the hallmarks of our treatment, is we really get our hands on people and really try to make them feel better via the manual craft that we've developed throughout the years. Occasionally when people come in, they already are coming in taking medications. If they are not, and we feel they have a lot of inflammation, then we will call the physician and say, hey, can you prescribe some non-steroidals, medication? Sometimes if the pain is really severe, we may recommend even a dose pack to really get the inflammation down so that we can do our work with the patient. We educate the patient is something we do initially. We advise them to avoid the bending and the twisting, because that's going to make that disc injury worse. And we also avoid sitting and lifting and any repetitive movements. And the big thing that I see is when people are cleaning their house, that's usually when they aggravate or they initially injure their disc. So be careful if you clean your house and you already have back pain, because that can definitely cause an irritation of it. The treatment that we do is based on an approach by Mackenzie, who's an Australian physician we developed a technique of extension, which I'll demonstrate some exercises here with Amanda on how to perform some of these exercises. If there's a nerve that's irritated, we're also going to do some nerve mobility exercises to get that nerve moving and some blood flow to it. And the hallmark of our treatment is going to be a lot of core strengthening, which is going to strengthen the muscles around that disc area of the hips, of the spine, of the abdominals, and progress to more functional strengthening, squats, lunges, those kind of things that are going to get you back to walking and sitting and doing the things that you wanted to do or that you can't do initially that you want to get back to doing. Okay, so I'm going to have Amanda join us here in a second. Let me just admit somebody who is joining us late here. Okay. Go ahead, let you do that. Okay. Hi, Pamela, how are you? Your microphone might be off. I think she just logged off. Okay, let's get back to the presentation. I'm gonna keep the screen share off for a second, and I'm gonna have Amanda demonstrate some exercises here. When somebody comes in with a really hot disc, guys, we want to get them on the stomach, okay? And that's something that's really important for these patients in that it's gonna create that extension where they're actually in a position on their stomach. It allows the muscles in the back to relax, and it allows a position of more extension. And again, extension is going to create a position or a pressure on their back, which is going to push the disc, if it's bulging out toward the back or toward the ceiling here, back into the position where it can actually be pushed back where it needs to go and allow for healing. Because discs can heal with time and the appropriate amount of treatment and the appropriate amount of management. So you want to go somewhere where they not only diagnose you appropriately, but are administering the correct treatment right off the bat. Okay, so initially we may just have them lay on their stomach with a pillow. And sometimes I'll have to have the patient use 4 or 5 pillows underneath their hips because they can't lay flat on their back. But just being in this extended position will provide a great amount of relief. And as they start to get better and that disc starts to heal, then we'll start to take away pillows from them until they can lay completely flat on their stomach without any support at all. And once they can get to that position, then we'll start to progress the exercises to more of an active extended position. So Amanda, I'm going to have you go into more of a cobra position on your forearms and elbows. Okay, so she's here. Now we're starting to really create a lot of extension and pressure through her back to again push that disc back. And as she starts to get better, she can start to arch up. Until now, this is more of an upward facing dog position, which is a nice yoga stretch that you're going to feel not only your abdomen, but again, creating that pressure on the lower back to allow that disc. So she's come into treatment 3 or 4 times. Her pain is significantly better. The nerve pain is almost resolved down her leg. And now we want to get into strengthening. So as she starts to strengthen, activate the muscles of her core, of her back, and because again, these muscles attach directly onto that vertebra of her spine, and it's going to help further heal that disc and again prevent that disc from coming out again or bulging out. So now, Amanda, I'm going to have you go into the thoracic extension, which is right here, and she's going to put her arms back behind her and extend back and up and hold. And she's going to feel the abdominals working. She's also going to feel her back muscles working again at the same time, promoting extension of her lower back. And let's do one more repetition. Hold it for 5, 4, 3, 2, 1, and take a break. As she starts to get stronger, we start to add the arms. So arms out extended in front of you, Amanda, and now extend up and then arms up out. Keep your legs down for now, and then we're gonna add those in a second. So again, hold for 5 seconds. Up 1, 2, 3, 4, and 5. And then now let's add the legs. Again, guys, this is a progression that takes sometimes weeks to get to. You may not get here because this may not be your problem, but it's something that we definitely progress patients through because they ultimately need to get stronger. A therapy session or a therapy series.
I can't hear you. You're too far from the mic.
Can you hear me okay now?
Yeah.
Okay, so what I'm saying is that a therapy session without strengthening exercises, I think is going to miss a lot of what we're looking for, because it's strengthening exercises that are going to allow you to get back to function, but it's also going to prevent that injury from occurring. Also, at this point, then once the patient is getting stronger, their pain is under control, we start to do a lot of squatting, deadlifting, functional things that people need to do around the house or for their particular work, especially if they're doing a lot of lifting or carrying things. That's something that you need to be trained at to do it appropriately and be brought along. Something that I won't demonstrate today that we do a lot of is the leg strengthening. A lot of patients that come in never really work their legs. They tell me, well, I walk every day for 10 minutes, 15 minutes. That's great. That's going to get at the cardiovascular component of strengthening, but you're not going to get the leg strengthening that you need that we would give you with exercises, because the legs are going to support your lower back, and that's going to create the foundation for injury prevention. Some of the techniques needed. Deadlifting that we're going to be teaching. That's appropriate for your situation. Questions at this point?
No.
Okay. Okay. So that is if a person has a disc injury. So now let's move on to the next. Okay. Here we go. Okay, so again, we talked about the McKenzie approach, and that was the extension position. We talked about managing the nerve mobility deficits. That can be a big issue initially because we want to get that nerve moving, because remember, it's entrapped. There's a kink along that hose somewhere, so we're trying to find where that, not only where the kink is, but to get that nerve flowing and moving well. And a lot of the nerve mobilizations that we do will get that done. And again, we talked about the core strengthening and why that's so important. Okay, so now let's talk about somebody who has arthritis. Somebody who has, another term for it is stenosis, DJD, DDD. If you have this as part of your prescription, it's again another fancy name for lumbar spine or lower back arthritis. These people are going to look a little bit different. These people are going to have more than 50 candles on their birthday cake. These people are going to have pain with standing and walking, which is the exact opposite of somebody with a disc, right? People with a disc have more pain with sitting and bending. These people have more pain with standing and walking. These are the people that you see at Costco or at Target that are leaning on that shopping cart as they walk because they're trying to take the pressure off of their lower back. They're going to be in that bent forward posture. And these people, the reason they have pain is because essentially they've lost height. If you can think of yourself or your relatives or friends, most people, as we get older, we get shorter. We lose several inches sometimes in our height. And the reason that happens is because you start to lose the height of these discs. So these discs are right here. Let me just get my cursor out again. So here's the disc right in through here. And you can see this disc here is pretty much flat. There's no more disc here, and you get this bone-on-bone effect. And what the disc does, it provides that cushion, right? And it provides space. So you can see there's a nice space here for this nerve to exit the vertebra. Here, that space is gone because the disc that corresponds to that segment is completely flat. So these people have lost all the fluid out of that disc, and as a result, there's no space for that nerve to travel out of. And there's where, and remember, you have about 27 discs in your spine. So if you lose even a millimeter off of each disc times 27, that's a lot of, height loss. And that's when you're going to see people losing height. So that's why we get shorter as we age, is because we lose the height of our discs throughout our spine. Okay, and as a result, these people will develop irritation on the nerve. So here is the kink for this particular person right at this area where that nerve exits the lower back. Okay. So what do these people do to get relief? Well, these people are going to sit. So if you need to sit to get relief from your lower back pain, or you need to bend forward and lean on a cart or something, it's highly likely that you have probably arthritis in your lower back, and that's what's causing your particular problem. Okay. So again, these people, when they come in, they could come in with really acute symptoms. They could come in with inflammation and a lot of pain that doesn't really allow us to do much exercise with them initially. So these are the people that we're going to do a lot of heat, massage, manual therapy. Again, a hallmark of our treatment is getting our hands on people, opening up the spine, relaxing the muscles that are in spasm or pain as a result of the disc injury. And again, sometimes we may recommend that person get some anti-inflammatories if it's appropriate for them. Okay. So again, these people, education is really important, decreasing their upright activity initially. So I may tell this person that loves to walk every day, why don't you give walking a break every other day to take some of the pressure off of your back, and maybe try an upright or a recumbent bike where they're sitting, just to get the exercise, but to take the compression that walking may cause on the spine, because these people do not like walking initially if that nerve is irritated. And I would promote more flexion positions in sitting or on their back position with maybe a pillow underneath their legs. Sideline positions can also be very effective to take and open up the spine and take the pressure off the nerve. Occasionally, these people may need traction. So traction is a machine that we attach onto somebody's lower back. It's like a harness, and there's a mechanical force that's created longitudinally along their spine to create space along that compressed spine to take pressure off the nerve. Again, these people will need nerve mobilization exercises to get the nerve flowing again. And again, probably the most important part of the treatment is going to be focused on core and hip strengthening. If I go back one slide, so when you look at somebody with arthritis here, there's ligaments that attach from one vertebra to the other. Okay, and the purpose of the ligament is to provide stability to prevent this spine from shearing and moving on top of each other. As we get older and that height of that disc decreases, those ligaments shorten. So now they've lost their property, which ligaments need to be tight in order to hold things together. When they get slacked or shortened, then that tightness is gone, and now that movement is going to occur more readily in this lower back vertebra. That in itself is going to create inflammation, and the inflammation itself can create that pressure on that nerve, which is so close by here in this area. So the purpose of the strengthening exercise for these patients is huge, because the muscles that we strengthen attach directly onto the vertebra right through here, and it provides that stability that the ligaments cannot provide or are not providing anymore. So this is why the strengthening is so important down the line, to make sure that this person not only gets relief, creates space, but also prevents that shearing and that inflammation that may result down the line. So it's a protective mechanism. You guys probably see a lot of people wearing low back braces, and why are they effective is because essentially it's creating an external brace to prevent movement from occurring. Well, if we take it a step further, if you create strengthening of the muscles that attach internally directly onto this vertebra, you're creating an internal brace, an internal corset, which we feel is more effective because it's attaching directly onto the vertebra. Okay, so that's why strengthening for these particular patients is imperative. So stretching is okay. That's going to get the spine to open up and the nerve to have some space initially. But ultimately, if you want to prevent and really see changes in the pain and improvement in function, it's the strengthening of the core and hip muscles that are going to be the key. Okay, so I'm going to demonstrate a few exercises that we may see somebody with stenosis doing in our clinic, and we're going to get our assistant back here again. And here is Amanda, and let me get on this side of the screen so Amanda can demonstrate. Let's do a sitting flexion stretch. So somebody who comes in initially on in their treatment may have a situation where their discs are, with their arthritis is really flared up, and all we can really do is flexion exercises or exercises to open up the spine and take the pressure off the nerve. So Amanda would slide her arms forward down her legs and allow that spine in the back to open up. And then go ahead and relax your arm. I'm going to tilt the screen down.
I do that too.
Her spine. Now what I want to do is I'm going to anything on her back. On her back. And come up carefully. This I don't cross the screen. Lay on her back now. Herself by pulling her knees into her chest. Normally we're going to hold this for about 20 seconds to a minute. Again, allow the muscles in her back to relax.
Mata situ mata pelobi na kanya mo kanya. Nena hiyo mata pelobi tadi mana mape keginya kanya po bilay kanya. Ang wadi baylay kanya.
Raul, can you talk into the computer?
Here. So, Amanda, again, can you hear me now? Raman?
No, we still can't hear you.
Let me go on this side because I think the speaker's on this side. Can you guys hear me okay now?
Yes.
Okay. I think this is working on the other side. So again, we're going to have Amanda hold this for multiple times and do this multiple times during the day to again relieve the pressure off of that nerve, allow the muscles that may be tight and in spasm to relax and help with that pain initially as they're starting with their therapy. As Amanda starts to get better, her pain is under control, and we're getting to the strengthening component of her therapy. Again, therapy can be done in phases. Initially, it's a lot of pain control with our manual techniques, our modalities. The initial phase is to regain movement and motion. So eventually, again, the hallmark or the most important part of the treatment is going to be the strengthening. So we're going to get into a strengthening exercise for her glutes. So man, I'm going to have you bend both knees, squeeze your glutes, and start to roll up your pelvis one vertebra at a time. So she's creating an articulation or rolling up a movement of her spine to create muscle contraction, and she's holding it to create some strengthening and endurance, and then roll it back down, Amanda, one vertebra at a time. Let's go through a couple sets of that, a couple repetitions. Squeeze the glutes and roll it back up. Good. And roll it back down. So now as Amanda starts to get stronger, subsequent sessions down the road, she's going to squeeze and lift and
knees
one leg up at a time. One vertebra at a time and one leg at a time. Now she's challenging her ability to hold her spine in neutral. Her pelvis is working, and now she's really progressing her exercise to make it harder for those and more challenging for her muscles. Anytime you start to do exercise, you have to have a progressive program. If you're exercise again, yes, you're going to master them, but eventually they will not continue to get stronger. You will stay at a stalemate, and you will no longer make increases in strength. And that's when things may either get worse or the pain may come back. You want to continually challenge yourself. So any program that you're on should be progressive. That initially starts off at your level or maybe a little bit easier and gets harder as you start to get stronger. Because that's the only way the muscle is going to change physiologically to again allow the strengthening to occur and more long-term effect to occur as well. Okay, so those are typical exercises that we may do with somebody in their clinic that has stenosis. The other one I'm going to cover with Amanda is called a marching exercise. The deepest abdominal muscle that we have in our body is called the transversus abdominis. And it's deep within the abdomen, and it's actually so deep that it's a respiratory muscle. So we're going to do an exercise where Amanda is actually doing a breathing exercise with her diaphragm to learn where that muscle is. So you're going to inhale, the belly goes up, and then exhale, their belly's going to go down. Inhale again, and exhale down. Good, last one, inhale, and exhale. This is allowing her to become familiar with her transversus abdominis. Again, another really important muscle. If you guys want these exercises, we can email them to you. Just maybe put that in the chat box or send us an email and we can send those exercises to you if you find that these are going to be helpful for you. We can do that. So now once she knows what this muscle is like to activate and what it feels like, now she's going to pull in and hold it in herself without necessarily doing the breathing. She's not going to do the deep breathing anymore. She's still going to breathe with a wonderful face like her shirt, but she's going to hold her abdomen in. And now, Amanda, you're going to do the marching exercise. You're going to lift one leg up, and not the bridging, but the marching exercise. Lift one leg up, hold that one there, bring that down now, bring the other one up, and then left one down, right one comes up again. As she starts to get stronger, then we're gonna go 2 legs at a time. Hold that one there, Amanda. Now bring the second leg up and hold that one there. That's much more difficult while she has to hold her abdomen in, use that transversus abdominis and some of her internal obliques to allow her to maintain that stability. And again, these muscles attach directly onto her spine and provide that stability for somebody who has an arthritic back or that. Okay, thank you, Amanda. So that would be a typical progression for somebody in our clinic who has stenosis. Again, initially we start off with treating their pain, manual therapy, modalities, massage, and then we progress to stretching and eventually to strengthening. Okay, so I'm going to go back to the presentation. Okay, the last area that we're going to talk about in terms of the causes of low back pain is the sacroiliac joint dysfunction. This is not the most common, but it is actually something that is commonly missed. A lot of times people come in with what other people think may be a disc injury or arthritis. A lot of times people come in with a sacroiliac joint pain. And when somebody comes in and they tell me it hurts right here, and they point to either the right side or left side of their lower back, closer to their gluteal area, right where this red mark here is on the pelvis, I automatically start to think this is probably somebody with a sacroiliac joint problem. Normally people with a disc injury are going to have the sciatica associated with it or a specific point in their lumbar spine here. Let me get my cursor out again. Normally their pain for somebody with a disc or a stenosis arthritic is going to be here. These people have pain right here in this red area, so closer to their gluteal area. And it's usually on one side versus the other, rarely on both sides at the same time, although we do see that as well. And what creates, and this particular population, they don't really have a specific age. I've seen patients between the ages of 13 all the way up to 80 years old with this problem, and we've been able to help each one of these people, equally. It's an area that is, or a cause of back pain that is commonly missed, but is actually fairly easy to treat. And if we identify it correctly, and we identify that as the kink of what's causing your pain in your back or the sciatica, it's actually fairly easy to treat if we administer the appropriate treatment. So what happens here with these people is they get an irritation of this joint here called your sacroiliac joint. So your sacroiliac joint is the joint between your sacrum, which is this muscle here. At the bottom of this bone is your tailbone or your little coccyx. Okay, people who fall often have this problem. People who fall on their rear ends, specifically to one side, are going to have this problem, because what happens is when you fall on your rear end, like I've had plenty of skiers come into the clinic with this problem, when they are snowboarders particularly, when they fall on their rear end, they tend to land on one side of their pelvis. And what happens with that trauma, it knocks the alignment of this joint. It doesn't dislocate, it just slightly shifts this joint out of whack, if you will. So now this joint is tilted, creating pressure on these ligaments. These particular people are going to be more common females. And the reason females have this problem more is because their pelvis is a lot more mobile than the male pelvis, and that's specifically for birthing purposes. So a female with points to one side of her gluteal area as pain. She's had it for a long time. She's tried several treatments, several providers. It's not helping her. I start to think a sacroiliac joint problem as we start to examine her. These particular people have problems with transitionary movements like sit to stand or twisting movements. Pain is common with these people. Because if you're sitting on a rotated pelvis or an area where the pelvis is rotated and creating a rotation, that's going to be painful after a while. So these people are going to complain of, I can't sit for long periods of time. Generally, walking for these people tends to be not a problem. It's with the sitting or the transitionary movements of sit to stand, twisting, in and out of the car. People who sit for a living are going to have a problem with this. And this will be important when we talk about considerations for chairs and ergonomics, which we'll talk about in a few minutes here. Okay, so again, pinpoint pain on the gluteal area is something that these people are going to complain of. So these patients, the first thing we do with these people is I manipulate or I adjust their pelvis pretty quickly. Is one of the first things I do to establish that normal alignment of the pelvis. That's going to take the pressure off that ligament at that joint, and oftentimes relieve their pain within 1 or 2 sessions. I've seen people get relief within 1 or 2 sessions. And then once they have that relief and pain and the manual therapy has been effective, then we start working on, again, you guessed it, strengthening core exercises to maintain that alignment so that they don't rotate out of that position again, and they're able to maintain their pain at bay. Okay, so again, these exercises are very specific to the particular side of the pelvis that's involved, and it's a progressive type of thing. So again, the exercises get harder to allow the strengthening to really occur. So does anybody have questions on any 3 of either the stenosis, the arthritis, the disc injuries, or the sacroiliac joint problems that we just talked about? I can unmute, you can just raise your hand and I can unmute you if you have a question. Go ahead, Robin.
Yeah, I was just wondering, I think I've been told I have 2 of the 3,
Yeah.
which is the herniated disc and the like the bone spur.
Mm-hmm.
Is that common that they go together, or?
Nice transition. That's actually, thanks for the transition. Yeah, I talked about them in isolation. Commonly, they come in pairs. Sometimes people have all 3. So we need to identify which one is causing the biggest problem, which one is the primary source of the kink, and treat them, accordingly. So we will treat the one that we feel is more contributory, because a lot of times, providers are going to rely on the MRI or the X-rays to diagnose you. We as physical therapists, we can't order MRIs or X-rays, so we rely a lot on what we see clinically and what you tell us from your subjective report. So to answer your question, yes, it is very common to have more than one of these problems that we just talked about. We in the clinic will do a thorough evaluation. Each one of our evaluations lasts about an hour, and you start doing treatment right off the bat. So once we identify where the problem is coming from, then the first day you start getting treatment. But again, the evaluation is the key part. We look at the MRI and the reports that you bring along with you, so we can see where, what kind of evaluation you've had, but it's clinically that is the most important to us in terms of being able to, determine what the best treatment is for you. So really identifying the source and where that kink is coming from is the most important thing for us. So when anybody have any other questions I can address really quickly before I move on? So when you talk about, what to do about this pain, the most common thing that we see in our patients, or even in talking to people who have back pain, is people, don't get into treatment right away. They will ignore it and delay it. That's kind of the reflex that we have as humans, is that if something goes wrong with our busy lifestyle, we have a lot going on, especially if it's a pain related thing, what we're going to do first is kind of ignore it, right? We're hoping, oh gosh, I don't want this to slow me down. I have a project due. I have some deadlines coming up. I don't have time to take care of this issue right now. I'm going to ignore it and cross my fingers and hope that it goes away. In most cases with low back pain and sciatica, it will not go away. And in fact, it will probably get worse. So if you are ignoring it, you're probably going to make the situation worse, because it becomes more convoluted and more difficult to treat the longer you wait to seek treatment. The other thing we do is we alter it. So one of the first things we do is we pop some Tylenol or Advil, which is fine. Sometimes we do need that to get things under control and get the inflammation down, but that's not curative, right? That's just putting a Band-Aid on it. So if that's what your treatment of choice is right now, again, you're going to be popping those pills for a long time, because you're not getting any identification of where that problem is coming from and how it needs to be treated appropriately. Okay, so what we recommend is, if you have pain, deal with it and handle it right away, because the more you wait, the more complicated it is to treat. In fact, there's been several studies that have showed that delaying your treatment not only increases your aggravation and makes it more difficult to treat, but it also increases your downstream healthcare costs. Because if you think about it, when you have back pain and you wait several months to get treatment, and you finally decide, you know what, it's really limiting me right now. I'm really in a lot of pain. I can't do what I want to do. I'm going to go get my, some advice from my primary care physician. Takes a couple weeks to get in to see him or her. He or she takes a look at you. I don't see anything. Let's do an x-ray. Comes back a week later. X-ray looks okay. Let's send you to an orthopedic. The orthopedic examines you. Maybe he might do an MRI. The MRI comes back, questionable, not really something that the orthopedic can do surgery on. Well, let's send you to physical therapy. Well, you should have been doing physical therapy right from 6 weeks prior to that and starting to address the issue right away. We don't diagnose medically, but we do diagnose clinically for physical therapy issues that we can address for you, and we can get treatment started right away. The state of California, we can see you without a prescription and start making you feel better right off the bat as soon as you come into our doors for an evaluation. So it's something that is unique to each clinic. Again, the first key step is to get that evaluation, identify where that kink is coming from so that we can address the problem appropriately. And like Robin said, sometimes there's multiple things going on. You could have a disc injury as well as a sacroiliac joint problem, and we as physical therapists are trained to treat both of those conservatively, naturally, without any medicine, without any injections, and certainly without any surgery, right? So that's what we do at M3 Physical Therapy, is that we do that thorough evaluation, and all of our therapists are highly, highly skilled at providing the appropriate treatment once we identify where that kink is coming from. Okay, so that's kind of the end of our normal presentation. Now I want to get into a little bit of the seating portion of the presentation and ergonomics. And when you talk about ergonomics, it's very relevant for this particular topic, is because a lot of us sit for a living, right? A lot of us who may have a disc injury sit, and we talked about if you have a disc injury, you don't necessarily want to be sitting all day, but if you are and you have to, you want to be seated in the right position. If you work for a living in a seated position in front of a screen, which a lot of us do nowadays in our era of computer and electronics and technology, we're sitting in front of a screen a lot, in a computer, on the phone a lot, and we're spending a lot of time in a chair, which right off the bat, I'm going to tell you, sitting for prolonged periods of time is very deleterious to your health. It can cause a lot of health problems down the road. So one of the themes that you're going to hear throughout these next few slides is you got to move. But if you have to sit for prolonged periods of time, you want to be seated in the appropriate position with the appropriate chair and with the appropriate desk set up. So we'll talk about that next, okay? So the three things to consider when you're talking about a home chair or a home office is you want to fit the chair to your body size. Secondly, you want to fit the chair to your spinal attributes, which it's different for males and females. And then third, and most importantly, you want there to be movement. You want to allow for your chair or your setup to allow for movement, and you yourself physically need to get up, move, stretch, exercise, and get out of your chair, which we'll talk about in a second. So let's first talk about fitting the chair to your body size, okay? We all come in different, shapes and sizes. Some of us are, shorter than others. Some of us are a little bit, more built, a little more sturdy. So we have different body arthropometrics that need to be adjusted and considered when you pick a chair. So just like you wouldn't, pick a nice pair of shoes because they're really nice, but yet they don't fit you because they're too small for you or too big, you wouldn't pick a chair just because it's really nice. It needs to fit you. I think it's more important to have a well-fitted chair than it is to have a really fancy chair with a lot of adjustments. So making sure that you fit the chair to your size is the first thing you want to make sure you consider. So when you consider the chair and the appropriateness of it, you want to make sure that the chair is supporting you and maintaining you in good posture. So what is good posture? Here is a demonstration of this person here. Notice that there is a lot of 90-degree angles here. 90 degrees at the elbow, 90 degrees at the hip, and 90 degrees at the knees. It's roughly what you want to see. Okay, and the way you achieve that is to have an appropriate seat pan that supports you here. And we'll talk a little bit more about the size of the seat pan. The edge of the seat pan should be just short of your knee, maybe about a fist width from the edge of the seat pan to the back of your knee. Notice also that the chair back is supported on this person's back. Women, which we'll talk about, tend to sit at the edge of this chair for whatever reason, and they never take advantage of the seat back. And you need to have that. You need to have this chair supporting you on your back. And the only reason and the only way this is possible if that chair that you pick out is appropriately sized to your particular dimensions. And then armrests are really important, which we'll talk about here in a second. You can see with this particular person here, it's actually a really nicely fitted chair. She's sitting all the way back in the seat pan. You can't really see it here, but that seat pan comes out just short of the back of her knee. She's wearing black pants and the chair is black, so you can't really see it. But right around here, the space between the edge of that seat pan and the back of her knee is about a fist width. So that's kind of what you want to look at. So if your knee is more than a fist width beyond or less than beyond that edge of the seat pan, then it's not the right size for you, because that's going to create pressure on the back of your thigh and could also put some irritation on that nerve, which we talked about earlier. Guess what nerve it is? The sciatic nerve, which we talked about earlier. Notice that she's also sitting all the way back. Okay, she is using the backrest, which has a nice lordosis here. Basically, this arching of the chair, you want to match it with the arch of your lower back here. And then she's not really using the back, the upper part of her chair, because she's leaning forward and typing. But if you're mousing or you're working on the computer, you want to make sure that that upper back is also supported. Okay, so all those components are really important. Seat pan depth and size, armrests used, make sure that the armrests are adjustable, both going in an up and down position, because we have different size arms. So these armrests need to be adjustable to accommodate for our different arm sizes and lengths. And they need to go in and out, not just up and down, but in and out, because some of us are wider or more narrow. So that's going to accommodate for the narrow and the width of our arms and trunk. Okay. I said earlier that I prefer a chair that is sized appropriately than one that has a lot of adjustment and doesn't fit you. That is true, but if you can have a nicely fitted chair with a lot of adjustments, it's going to allow for a more tighter fit to your particular body size. So the more adjustments, the better. But again, the biggest thing is to make sure that that chair fits you appropriately, just like a nice pair of shoes would, or a nice fitting pair of shoes would. So we also want to fit to your particular spinal dimensions or spinal alignment. Men tend to sit more in a flex posture, more of a rounded back here that you see. Men tend to need a reclining chair because they're already in a flex posture, so they're going to lean back more as they're sitting working on their computer. It's just the nature of the way we're built. Our pelvis, again, isn't as mobile as a female, so it's going to be defaulted in more of a flexion position. Females, on the other hand, tend to sit a little bit more upright because their pelvis allows for that to occur. Again, pelvis, the female is going to have a more mobile pelvis for birthing purposes. So they're going to be in a more upright position. This particular person or diagram, you can see the space here. That's not correct. This person should be sitting all the way back. Again, females are going to tend to sit more at the edge of the seat pan, which is something for prolonged periods of time, which is going to cause damage and pain in your lower back. So you want to be this nice posture, nice alignment, but you need to use that backrest to appropriately support that alignment that a female is going to need. So the male reclining chair, very important. A female, obviously sitting back at the edge of the chair, but also having a seat pan that accommodates for the position of her pelvis. So a nicely adjustable seat pan forward and back, and then maybe even an adjustable tilt, which we'll talk about in a second here, is really important. So females and males, definitely going to be different there. So when we talk about allowing the chair or your desk setup to allow for movement, this is a nice example of it. This particular chair allows for a lot of movement because, like I said, even if you have a nicely set up chair that fits you perfectly, you still don't want to be in that chair 8 to 10 hours consecutively during the day. You need to get up out of your chair. And if you're sitting in your chair, it'd be nice to have a chair that allows for all this movement to occur. So if you need to reach to the right, the chair can tilt and allow for that right movement to occur. If you need to lean back like a male does, like we talked about, you want that reclining function to be there. If you need to reach down, you need that seat pan to tilt like it is here. And then you can see here, this particular chair, which I won't mention the name, the purpose of this presentation is not to promote a particular chair, but more to present concepts, has a very narrow upper back. So it allows his shoulder blades to move and his shoulders to move back. This is a really nice chair that allows for a lot of the movement to occur. So why is movement so important? When you sit in a chair for prolonged periods of time, even if you're in a good posture, your muscles are working to maintain your posture, but they're not dynamically stretching and shortening like muscles are meant to do. And when that happens, and when you have muscles that are sitting in a position where they're working, but they're not moving, which means not lengthening and shortening, it creates a situation of anoxia, which means that you get a decrease in blood flow to that muscle. So what does a decrease in blood flow result in? A decrease in oxygen. And we all know that oxygen is so important for not only us, for us to live, but also for the muscles to be healthy. A lack of oxygen to muscle is going to cause weakness and eventually pain. So you want to be able to move. We recommend that you move every 40 minutes. You get up out of your chair, even if it's for 2 to 5 minutes, just to get a cup of water, a cup of coffee, whatever the case may be, but you want to be able to move. The best movement is active stretching and strengthening exercise, which are going to, again, shorten and lengthen those muscles because that's what they need. That's going to bring blood flow to those particular muscles, okay? So these are just some examples of exercises that you can do at your desk to stretch your neck, your trunk, your lower back, and this person is standing to stretch her chest. So again, movement is so important. So the chair should allow you to move, but you should also take breaks every 40 minutes, even if it's 5 minutes to do these stretches. And there's many others that we can recommend for you once we know your particular situation. Okay, the last thing I'll cover is a sit to stand desk. These have become really popular recently. In fact, I just bought a couple of these for my kids because they're home from school, and with the demands of school, especially high school, my daughter could be sitting up to 8 hours a day. The sit to stand option allows you to change for positions from a sitting position here to a standing position here. Again, allowing for that movement to occur, the circulation to occur, not only in the back, but also the legs. And I mean, who can sit for, that long without changing position? It helps with that restlessness that we have. These sit to stand desks go all the way down, almost pretty close to the floor, so that you can actually sit on the floor in a circle sit position and do some work. So it allows you to be productive and allows you to change your position and again, prevent that muscle damage, which we just talked about. This particular gal is sitting on actually a recumbent bike. And is set up really nicely. You can see her posture really nicely upright. And this particular, it's instead of using a chair, she's using a bike. So she's moving her legs. And even if this person doesn't get up for several hours, she's still moving her legs and creating circulation to her legs and the muscles of her back, and still allowing her to be productive. So we know productivity is very important, but if you don't take care of your body, you're going to break down and your productivity will decrease to 0 because you won't be able to sit for very much longer. Okay, so it is something that you want to address if you're having this particular issue, particularly right now where people are sitting so long at home during COVID and don't have their regular desk set up. Any questions on that so far? We're good? Okay, I'm gonna show you a quick video here. I hope this plays. And it talks about a specific chair. It'll talk about a lot of the concepts we already talked about. It's just 2 minutes. It's a nice demonstration of the different adjustment a chair can provide for you. And again, some general basic principles on how to fit your chair to make sure that it's supporting you and preventing injury. Okay, so we're gonna start the video. Okay. So that was the end of the video. She talked a lot. So basically the notes that you want to make sure that you accommodate for when you're setting up your chairs, you want to make sure your feet are flat on the ground. If you're a shorter person and your feet are dangling, that is a bad situation. You need to adjust that chair height, or if you've adjusted everything and you have everything perfect, but your feet are still dangling, you want to make sure that you get a little step stool to make sure that your feet are not dangling. I have these for my kids at the house because they're obviously a little bit shorter. Their chairs are nicely set up on their sit to stand desk, but their legs are hanging. So we bought them some nice footrests so the feet are not dangling. The feet dangling can cause some nerve damage in the back of the legs if you're sitting for long periods of time. The height of the chair should allow for your knees to be in line with your hips. So that's really important. The seat back should be able to support your back. Again, you want to sit all the way back in your seat so that it is supporting your back. You should allow for tilting. The chair hopefully will allow for some tilting of your pelvis. This is especially important for women who have that pelvis that is slightly tilted forward. And then you want a reclining adjustment for men, especially who tend to sit more in a reclined position, again, because of the pelvic position. And lastly, we want to make sure that your armrests are adjustable so that they support your arms and they're a direct extension of your desk. So having adjustments for both height as well as width, really important to accommodate for the different arm lengths and the different widths of our bodies and arms. Okay. So that is it as far as adjustments for chairs, ergonomic assessment for a desk. Does anybody have any questions? Okay, very good. So I thank you guys for coming. Again, if you guys need help for figuring out what's going on with your back, if you want to treat for immediate pain relief, give us a call. We are here. We're taking appointments. We have wonderful physical therapists that can help you, help you figure out what's going on with your back, get you out of pain, and get you back to living the life you want to live, and more importantly, helping to give you some tools to prevent injuries from occurring. If you want to check us out further, look at our website. It's www.m3pt.com, and you can see some of our other therapists and some of the things that we're doing in our clinic and our community to help people get out of pain and get them living. If you have any further questions about the chairs, or if you want the exercises that we demonstrated in class, go ahead and email me. The email is on our website, or email Amanda, who set up this this Zoom meeting, and she can get you the information as well. Okay.
So Raul, would you do like a consultation first and then you would tell what kind of PT or whatever is needed? Is that how it would go?
Good question. So we could do, one of a couple different things. We would offer you a consultation, or what we call it, there's one of two things, an evaluation. In the evaluation, we would evaluate you and figure out where the kinks are coming from, and then administer the appropriate treatment. So you're getting treatment that first day. If you just do a free screen, which is also a consultation, the screen is about a half hour. That you're going to meet with a physical therapist, have a one-on-one session with them, but they're only going to screen you and figure out if it's something that they can help you with and how they can help you with. You won't get any treatment that particular session. So we always suggest, if you're ready to get treatment and ready to start feeling better, sign up for the evaluation. If you just kind of want to figure out what's going on with my back, is this something physical therapy can help me with, then maybe you might do the free screen. Okay. And then again, the evaluation will start treating you right away.
And you're saying you don't need a prescription from the doctor?
Technically, no, Judy. In the state of California, we can see you without a prescription. However, certain insurance companies do require us to have a prescription on file. And we could let you know that once you called our office and scheduled an appointment, and we took down your insurance information, and then we could look into if you need a prescription. Okay.
And do you by any chance work with Kaiser Permanente or no?
Unfortunately, we do not. We have quite a few of those questions because there's a Kaiser right down the street from us. But no, we do not have a contract with them, but we do see quite a few of their patients, just because we tend to provide a lot more specific one-on-one treatment that we think is, and patients think is also more effective.
Okay.
Okay.
And are you business as usual now during COVID?
We are open. We've been open the entire time, serving the needs of our community. Our clinic is very safe. We are taking every precaution We take temperatures, we do screening questions, we keep the place immaculate. We do a lot of one-on-one care, so there's not a lot of patients in here at the same time. So we're, you're pretty much with your physical therapist the entire 45 minutes to an hour that you're here. So you're getting a lot of one-on-one specific treatment, which we feel people tend to, they need, because I think if you're getting that one-on-one care and you're really getting to the heart of what the problem is or where your pain is coming from, people tend to get better a lot quicker. Versus if you're in a big room with a bunch of people and you got a bunch of people working on you, there's not as specific of an approach there, and things tend to heal a lot slower if they heal at all. We also, if you are still a little leery, Judy, we do e-visits where we can see you via Zoom call over the internet, and we can evaluate you and start treating you with an exercise and education-based approach. Of course, you won't get the manual treatment, but a lot of times the exercise, like we mentioned in our presentation, is the most important part. And we're doing that with all of our patients as well. And some of our patients have really benefited from it. For those who are, may have a medical issue where they can't come into the clinic, or they're just a little bit afraid, we're able to provide that service. And insurance companies do cover that, and they cover it fully. So it's something that was, recently implemented since COVID started back in March.
Okay.
So if you are interested, Judy and Robin, give us a call, and our receptionists can take your call tonight or tomorrow morning, and we can get you on the schedule as soon as possible.
Okay, thank you very, very much.
Great. Thank you. Thank you.
Yeah, so drop us an email if you have any further questions. This will be recorded, so if you want the recording, we can send that out as well.
Okay.
Perfect.
All right.
Thank you, Rob.
All right, guys.
you.
Well, thanks for
Thank you.
joining us, and you guys, good luck.
Thank you.
Bye-bye.